Good day, everyone. Welcome to our rationalization for Nloa 1 Prelim examination. And I'm actually in charge to discuss the answers for Nursing Practice 1, Care of Individuals, Families, Population, Groups, and Community, or the Community Health Nursing, specifically B1 or the Healthcare Delivery System. Let's begin with question number 1. The situation is, in order for the nurse to function effectively, she has to understand the healthcare delivery system wherein she is working because it influences her status and function. Question number 1. Which of the following agencies will be responsible for the protection and promotion of the people's health? A. Local government units. B. Department of Interior and Local Government. C. Department of Health. Or D. Barangay and Municipal Council. This is actually a very simple question. Of course, we know that the national government that is protecting the health of the people is basically the Department of Health. The Department of the Interior and Local Government is actually very responsible in governing the local government units. Therefore, we eliminate letter A and B. So the answer for number 1 is letter C, because the DOH is considered to be the principal health agency in the Philippines, responsible for ensuring an accessible access to basic public health services, and it's also very significant for protecting and promoting the health of all Filipinos. The best answer for number 1 is letter C. Question number 2. The DOH roles are categorized into three major functions, namely leadership in health, number 2, enabler and capacity builder, number 3, community organizer, and number 4, administrator of specific services. Of course, the Department of Health is having three main roles and three main function. And the first one is number 1. So eliminate natin yung letter B because it does not have any number 1. Leadership in health is very significant because the Department of Health is responsible in setting policies and national health directions. And second function of the Department of Health is enabler and capacity builder. So we'll eliminate letter D because it's 1, 3, 4. So we're left with A and C. We know that the Department of Health is actually an enabler and capacity builder because they provide technical assistance and at the same time providing standards and guidelines to the uh, barangay health stations and other part of the Department of Health. And of course, number 3, they are actually responsible of administrating specific services. Therefore, it's 134. Eliminate natin yung letter C. So the best answer for number 2 is 134 because we know that the Department of Health directly manages hospitals, directly manages specialty centers, and of course, we know that if you're talking about community organizer, that's the primary function of LGUs and community workers, but not the function of the Department of Health. Number 2 is 13124. That's letter A. Question number 3. The law that require nurses employed by the DOH to discharge their duties with utmost responsibility, integrity, competence, and to uphold public interest over personal interest is A. RA 6758, B. RA 6713, C. RA 8976, or letter D. RA 8749. Of course, we know that when we talked about utmost responsibility, utmost integrity, and competence, we're actually talking about the code of conduct and ethical standards of public officials and employees. So this law mandates public servants, and that includes government nurses, to serve with accountability, integrity, and loyalty to the public, and that is RA 6713. So number 3, the best answer is letter B, RA 6713. Number 4. Under the current administration, the vision of health is reflected in one of the following statements. Is it A, health for all Filipinos? Letter B, health in the hands of the Filipinos? Letter C, the leader of health for all Filipinos in the Philippines? Letter D, the guarantee provision of quality health care? Of course, we know that that's basically a long-standing DOH vision, and that is through empowering individuals, families, and communities to take responsibility for their own health. So we will eliminate A and C because that is absolute, all Filipinos, all in the Philippines. So the best answer for number 4 is letter B, health in the hands of the Filipinos. As what I mentioned, this is a long-standing DOH vision, and they are still guided by this vision, and that is achieved through empowering the families, individuals, and communities to take responsibility for their own respective health. Number four, the answer is letter B. 5. This statement refers to the new mission of the Department of Health. A. Ensure accessibility and quality healthcare for all Filipinos, especially the poor. B. Guarantee D. Equitable, sustainable, and quality health for all Filipinos, especially the poor, and shall lead the quest for excellence in health. Letter C, health for all Filipinos, or letter D, to lead the country in the development of a productive, resilient, equitable, and people-centered health system for universal health care. Of course, when we say new mission of the Department of Health, that is actually aligned with RA 11223, and that emphasizes equity, there's resilience, and people-centered approach. So therefore, the answer for number 5 is letter D. A, B, and C are the previous mission of the Department of Health, but that's actually not focusing on the universal healthcare. Number 5, the best answer is letter D. Question number 6. The health sector reform agenda is considered as the A. Goal of the DOH, B. Goal of the primary healthcare, C. Framework of the DOH, or D. Main strategy of the DOH. Of course, we know when we talk about the health sector reform agenda, that is actually a strategy. So the best answer for number 6 is letter D, because this is actually used by the Department of Health in order to reform our Philippine health system to achieve better health outcomes and at the same time efficiency of our services to our community. Not the goal of the DOH and not as well as goal of the primary healthcare, but it's actually the strategy of the Department of Health to implement services to the recipient of care. 6 Delta. 7. The areas of DOH reforms covers the following except A. DOH political reform, B. Health financing, C. Health regulation, or D. Public health programs. Of course, we know that the health sector reform agenda, this covers health financing, that is letter B is correct. Health regulation, that's also correct. Public health programs, that's also correct. Health service delivery, and also governance, but not political reform. 7, the best answer is letter A. B, C, D are part of the DOH reforms. 7, alpha. Number 8. The health sector reform agenda focuses on the reduction of IMR and MMR control of infectious diseases, addressing the rising burden from chronic and degenerative diseases, and improvement of the services provided to the poor. This framework of HSRA, or Health Sector Reform Agenda, intends to implement critical interventions as a single package backed by effective management infrastructure and financing arrangement following a sector-wide approach. A. Health financing, B. Health insurance, C. Formula One for health, or D. Local health systems. Of course, we know that um, the health sector reform agenda crafted a specific package that is combining services into one. And we know health financing and at the same time health insurance is actually included in that specific package. But what we're talking about here is an approach, and that is letter C. Because Formula One for health integrates health system reforms into single cohesive framework for effective implementation. So part of that is A and B. Number 8 is Charlie. Number 9. All but one of the following are included in the elements of the Formula One for health: health financing, good governance, health regulation, or multi-sectoral linkages. Of course, we know that the four elements of Formula One includes health financing, health regulation, health service delivery, and good governance. What is not included is actually multi-sectoral linkages, because these multi-sectoral linkages is actually part of that's actually encouraged, but it's not part of the four pillars of your Formula One. Again, the four pillars of Formula One is health financing, health regulation, good governance, and health service delivery. Number 9, Delta. Number 10. This is the key feature of the Formula One for health: A. National Health Insurance Program, B. National Objectives for Health, C. Primary Health Care, or D. Health Sector Reform Agenda. Of course, we know that National Health Insurance Program is actually part of the PhilHealth coverage. National Objectives for Health that is specific for every administration. Primary health care that is actually have started even in Alma Ata. So number 10, the best answer is letter D, Health Sector Reform Agenda. So your HSRA uh, is actually operationalizes the Formula One, making it the key feature of this framework. So number 10, the best answer is letter D. 11. The public health nurse should be aware of some changes in the healthcare delivery system as a result of local government code. The delivery of basic services was devolved to the local government units. The legal basis for this is embodied in RA 7305, Executive Order 119, RA 7160, or Executive Order number 266. Of course, we know if that is devolution, that is the Local Government Code of 1991, which devolves services to the local government unit, be it in the municipal, the city, or the provincial level. And that is under RA 7160. 11, the best answer is letter C. 12. Health services were devoted to the local government units for the following reasons, except to transform LGUs into self-reliant communities, B, to involve people in the development and progress of their communities, or C, empower local health officials, or D, to provide people better access to decision making. Answer for number 12 is letter C, because the goal was to empower communities and local government as a whole, not just the health officials. And empowering only health officials would centralize power rather than democratize it. So the best answer for 12 is letter C. 13. I think this is the last number. Local health boards were established at the provincial level, provincial and municipal levels. At the municipal level, the chairman of the board is the a rural health physician, B, public health nurse, C, municipal mayor, or D, chairman of the committee on health. Of course, when you say the chairman of the health board, should have to be the chief of that specific area. If that is municipal level, it should be the municipal mayor. If that is in the city level, that should be the city mayor. If that is the provincial level, that should be the governor. So the local health board is chaired by the local chief executive, and of course with the local health officer as vice chair. So we know that the chairman of the committee on health is actually the vice chair, and that includes members of the physician and at the same time the public health nurse. The best answer for 13 is letter C. So that is it. Thank you so much for your time. Congratulations, those who made it.